Shall we start? Shall we all rise up for a word of prayer? I'll request Achan to kindly.
നമുക്ക് പ്രാർത്ഥിക്കാം. പിതാവിനും പുത്രനും പരിശുദ്ധർഹായ്ക്കും സ്തുതി ആദ്യം നന്ദിയേക്കും തന്നെ. ആമേൻ. കാരുണ്യവനായ ഞങ്ങളുടെ സ്വർഗ്ഗസ്ഥ പിതാവാം ദൈവമേ, ജൂൺ മാസത്തിൻ്റെ 3-ാമത്തെ വ്യാഴാഴ്ചയും ഞങ്ങൾക്ക് ഈ തിയേറ്ററിൽ കൂടുവാൻ കൊണ്ട് ഞങ്ങളെ സഹായിച്ചോർത്ത് നന്ദി. ഇന്നും ഞങ്ങൾ കേൾക്കുവാൻ പോകുന്നത്, ഈ ഭൂമിയിൽ ഞങ്ങൾ ജീവിക്കുമ്പോൾ ഞങ്ങൾക്ക് വേണ്ടിയല്ല ജീവിക്കുന്നത്. വി ലീവ് ഫോർ അതേഴ്സ്, വി ലീവ് ഫോർ ഗോഡ് എന്നുള്ളതായിട്ടുള്ള സത്യം ഇന്ന് ഞങ്ങൾ കേൾക്കുന്ന കാര്യങ്ങളിൽ നിന്ന് മനസ്സിലാക്കുവാൻ സഹായിക്കണമേ. അത് അവതരിപ്പിക്കുന്നതായിട്ടുള്ള ഡോക്ടേഴ്സ് മറ്റുള്ള എല്ലാവരെയും ഞങ്ങൾ ഓർക്കുന്നു. ദൈവത്തിൻ്റെ സാന്നിധ്യം അവരോടൊപ്പം ഉണ്ടായിരിക്കണമേ. ഇന്ന് ഞങ്ങൾ അനുഗ്രഹം പ്രാപിച്ചവരായി ഇവിടെ നിന്ന് മടങ്ങുന്നവരായി തീരുവാൻ സഹായിക്കണമേ. പ്രാർത്ഥന കേട്ടതിനായി നന്ദി. ഞങ്ങളുടെ കർത്താവും ഞങ്ങളുടെ രക്ഷിതാവുമായ യേശു ക്രിസ്തുവിൻ നാമത്തിൽ തന്നെ. ആമേൻ. Please be seated.
Good morning, everyone, and welcome to the Quest. As you all know, when we heard the word Chattisgarh, that is a place which conjures up various images, no? Images of Naxalites probably is the first thought which came to my mind when I hear of Chattisgarh, and all the negative thoughts come. But actually, Chattisgarh is a very beautiful state which was carved out of Madhya Pradesh not so long ago. And we had 2 of our groups of medical students going there to sister hospitals, one in Jagdishpur, where Dr. Rajesh Joseph and Dr. Leena were the accompanying faculty, and as well as Dr. Relivable Cherian went to Champa Christian Hospital in Chattisgarh. And we will today, without wasting much time, we have had a little delayed start, so we will start straight away, and I'm going to request Dr. Rajesh if you could start off with Jagdishpur and the experience there from his perspective as a accompanying faculty. We had the prayer. Just for everyone to know, we have 15 to 20 minutes each team, so then we should finish by 9. That's our plan. Okay.
Good morning to all of you. Yeah, it's clear. Thank you, Dr. Philip. I feel it was in the month of March, I get a call from Dr. Philip asking that we have a secondary health program happening in various mission hospitals all over the country. Are you interested? So the concern there was, you are heading a super specialty building, you have a lot of patients in the OPD, and it's a 2 weeks program. Is it possible? Should I take the decision of moving? George Chanti sir, it was a person who always wanted this program to happen, and sir wanted super specialties also to be strongly involved in this program. So maybe if I would have refused, then it would have been a loss, a great loss, because the experience was of such a wide spectrum, it was such a wide dimension, that I really fear that if I would have missed it, it would have been a loss. Now, this place, Jagdishpur, is entirely new. Chattisgarh, I have never gone in my life. But I was born and brought up in the state of Assam. That was way back in 1970. From then onwards, I have been throughout in different states of Assam. And we had whites running mission hospitals in those places, because Assam at those years is not at all a developed place with a lot of social issues. So I have gone through mission hospitals as a patient, as a child who went for vaccinations and those kind of things. But then that experience was renewed as a doctor when I went to this mission hospital. Jagdishpur, we started our journey, and I wish to thank the students who accompanied the program, because it was for them definitely, but then they took a lot of initiative, and there was a drive for us to make us comfortable. So the final year student, Dr. Grace, happened to be with us throughout our travel. We started on April 10th. And once we reached Jagdishpur, the place, it was actually a very less populated area, the house we stayed, the hospital, everything looked it's a kind of structure which we have which is not good. Like when we come from such big hospitals and we go there, we find it was in a bad shape. However, the quality of work which is going there actually moved us. That was the experience which we wish to share. The courtesy for the slides goes to the students themselves. They had prepared the slides and they had actually once presented it. I have taken their help once again to represent the same slides. Thank you, all of you. This is the Sewa Bhavan hospital where we went in Jagdishpur. This photo, in this picture, we can see from left to the extreme right, we have Nirmal, Rahul, Ria, Roshan, Grace, and Nittu as the interns who were with us. Not the interns, sorry, the medical students. And then both of us, and then comes Dr. Augustine, who is the cardiologist who did his PG training from CMC Vellore, who has dedicated his life for the mission hospital. He's a cardiologist, he can be an anesthetist, he can even be a surgeon, he can be anyone when the need arises. Then his wife, Dr. Bella, who's a pediatrician and who does a lot of things required because, most of the resources are not available. So with minimum resources, she tried her best to help the newborns and the babies. Then Dr. Jason, who's a junior doctor there, Dr. Manoj. Then comes Dr. Timothy, who's a radiologist there, and he's actually a person who is involved in every other activities along with his radiology as radiologist, because the entire supervision of the hospital structure, the availability of resources, and the greenery there, the environment there, everything he takes care. Then we have a nice person, a pulmonologist, Dr. Simeon. So they are the pillars on which the entire hospital rests. And I really feel amazed at the work they do, because they cover each and every area, and it's actually a complete place. If you look at it, there's a cardiologist, a pediatrician, there is a we have a surgeon, her picture's not here, we'll go to it, and a pulmonologist, intensivist, radiologist. In fact, it's a complete place. I feel this kind of completeness we don't get in a mission hospital. And we have to thank God that they are also interested to stay back in this hospital. This is a ward where every department patients get admitted. So there might be cardiology patients, surgery patients, gynecological patients, everything, pediatric patients, everything in this ward. Because this is the only ward which was available. And if you look at the infrastructure, it is very poor. But then there's been no kind of maintenance possible because of lack of fund. However, the quality of work which the clinicians are doing there is very, very adorable, in fact. There is a cesarean going on. The junior doctors there, they do all surgeries. They do minimum appendectomy surgery, cesarean deliveries, and minimal surgeries, whichever is possible by a doctor has been done. They do there. And our students were also lucky enough to assist in these procedures. This is a lab here. We have the X-ray area, the ultrasound room, and we also have an echo. It's a kind of a, because to get license is quite difficult when you go for the bigger ones. So they have a handy bedside echo machine. And so almost every service is possible. What was the caseload there? We found that there was around 1,349 patients in the month of April. Out of that, in emergency, they had 167. IP was 251. OP happened to be 937. What is the issue? The problem there is the logistics in that place, because there is no private or government transport service. So there are no buses plying. So if someone has to come to the hospital, they have to find their own means of transport, which is very expensive, and most of the people won't have a vehicle. So if they come, most of them try to get admitted. So come as OP and then get admitted. And once they are very sick, they come straight to the emergency. These were the different cases during that time in the Department of Cardiology, for cardiology, gynecology, pulmonology, pediatrics, surgery, and emergency. So how does the day start in Sewa Bhavan? Morning at 8 a.m. it starts with devotion prayers. So it's actually a very nice, it comes to almost 20-25 minutes. And they do a good Bible reading, and there is a small discussion regarding the good things in life which can be done. And there is a song, and our students definitely gave a lead there. After the song, after this morning prayers and the song, we have a previous night discussion about the patients that were admitted in the hospital. So this is the time when cases are being discussed. Some theory is being discussed. Clinical diagnosis, what more can be done, goes during this time. So after this, we all break for breakfast and then come for the rounds. So these were the different ways in the departments of medicine, surgery, gynec and pediatrics, whatever things happened during this period. So platform our hospital with these facilities, and the doctors there with the nurses and the other supporting staff, their contribution as a team, and the process that of learning whatever we learned during our period there is just priceless, it's worth mentioning. There's a child here with a valvular heart disease which was repaired elsewhere, was admitted with chest infection. You have a lady next to that in the picture who's come with an HB of less than 2, and she was transfused with blood, and then she has recovered and she was discharged. There is a bedside echo, Dr. Agustin doing it. We have the morning rounds in the private ward where the cases were discussed. Our students with getting their hands-on experience. Here we have the surgeon in the center. You can see her. And because chronic kidney disease patients were there in this hospital. We got so many patients who had renal failure. And the problem is there was no facilities for dialysis, and there is actually a bit of difficulty which the clinicians faced regarding fluid management, electrolyte management, which we could help when we went there. So there was the patient who had severe renal failure, fluid overloaded, who wanted at least some kind of a dialysis and fluid removal from his body. So we decided on doing a acute peritoneal dialysis. And there's a surgeon here, she put the catheter, dialysis catheter, and we dialyzed him, and his creatinine dropped, and we could send him home. The thing is, whether to, acute PDs can be done in situations where there is, you help the person to live some more, but during this period, they might all get a natural recovery if there is some acute kidney injury component to it. So this patient did better, and we could discharge him. This is the community outreach areas. There's a village named Bhojpuri. There's a person on the left. He had actually an RTA following which he was bedridden. And then our hospital helped him to recover because there was no aid from any government sector. The community outreach with the nurses and our students. So this is what the students felt about the transformation. I just put it to a slide. I felt it was very nice thought. And this is a dinner we had at the last day. It was a 2-week program, but then we as super specialty, we couldn't spend so much of time there. So we had to come back within a week. But the experience which we gained during this period was so different because we can actually do a lot of things. But when you're in a place like Kerala where there are very high chances of having legal issues, we have a tendency to keep back from doing a lot of procedures and things in this hospital or in this state. But these patients, there's nothing much called a consent and all we take from these patients. Just tell them we are going to do this. And whatever the doctor says is accepted there. The patients have not much of a questioning. They accept whatever treatment is given because they know that they have a kind of trust that once they come here, they will be relieved of their issues, their problems. See, this, whatever I'm speaking today is from my memory vault over these days. And where we have decided that we can train to form a nephrology team there. And we used to have phone calls, discuss patients, and they have an interest in starting a dialysis unit there. We have decided to train 1 or 2 technicians if they can send them here. Nurses for 2 months is enough. They can learn the procedure. And we can also train them with the CMAI program. And we said that we can sponsor them if they have financial problems. So these were the plans, and we are trying to get it done over these months. And this is, I feel all of you can take this kind of visits in the coming years and learn more attain more experience. As a person who has gone and come back, I feel I should be going again next year if I get an opportunity. Thank you so much.
Does anybody want ask any questions when ma'am sets up the presentation? So this hospital just 2 hours away from where Dr. Rajesh was in Jagdishpur is a place called Champa, again in Chattisgarh. And Dr. Elizabeth will share her experience, and then we'll have a time of interaction and questions. Thank you so much, Rajesh, for sharing. And I think it's something which will be very beautiful if many of you next year also will take this opportunity to go. Thank you.
Good morning, everybody. First, I would like to thank the institution for giving me this opportunity to go for this secondary hospital postings, though I am not a member of the faculty. But there was a key requirement of me. I was told to help this hospital because they were going for accreditation. So that was an additional agenda for me when I went with the students this time. So this is our journey towards Champa, which is in Chattisgarh. It was the first time in my life I started on an Easter morning having grapes for breakfast. So we went by the Korba Express. I don't know whether you know about Korba. Korba is a place in Chattisgarh where there is a quest for black diamonds. Coal is being unearthed, mined and taken to Calcutta, 800 kilometers away, to Nagpur, 500 kilometers away for the resource. Our trains get delayed by 3 to 4 hours because coal train is given a priority. So you see that is Korba. And Chattisgarh is supposed to be the rice bowl in India as well, because it's got there are 2 crops of rice being cultivated every year. So this is the lake view. And if you look down, we went in the month of April when the maximum temperature was 42 degrees. We are sitting, I think, here with 25 degrees. Now this is my team. Now if you look at it, I have more than 6 children or 6 students, because the team from some of the students from Jagdishpur also joined us. So we had a good time. So we were actually able to even watch a movie together. So they have a well prepared. And the roads show the sign, Beti Bachao. Beti ko padao. Dr. Rajesh was saying we do have a lot of female infanticide being practiced. That is one of the reasons why ultrasound machines are not given licenses. Now this is a screenshot of the Champa website. The Champa Hospital is under the Evangelical Hospital Emmanuel Hospital Associations. It is called Champa Christian Hospital. It was actually established in 1926. With 75 beds now, all the population is about 80% below poverty line. They have almost 80 deliveries a month. There is no pediatrician, no neonatologist. At 45 degrees, baby is sent to another hospital just because the government says there has to be a pediatrician. So the baby is sent there and brought back if the baby is fine. So as I told you, it is one of the hospitals which has been showcased, as far as I am concerned, in the intensive care unit. There's a lot of problems. So this is Champa Hospital. The building is here. Very neatly kept hospital with lots and lots of tamarind trees. Anybody wants tamarinds? I can give you some. So this is Champa Christian Hospital. They are aspiring to go for accreditation. They have been told by their head office in Delhi, everybody should go for accreditation. Can you compare this hospital going for accreditation when you compare Believers Church Medical College Hospital? We went through the process of inspections last week. So the first thing which impressed me there was women empowerment. Who is the CU there? This is Manjula Dinam. She is basically our staff nurse, studied in CMC Vellore. Her orbit has crossed Dr. Philip Finny's, and her husband was the previous administrator. If you see on the group on the left side, these are my students. They were very nice. I had such a homely, sisterly, affectionate relationship with his family. So she housed us in the flat next to hers. So this was taken with the students on the day we left. She gave us a dinner. Now she is the force, or she is a woman or the one woman army there. She does everything and her schedule is always on time. 8 o'clock in the morning, she is there as a first person to come for the devotion. She expects all her staff members to join her in the devotion. And if you look at that day, under the EHA, to get sponsored by EHA to CMC Vellore, there's a tie-up. So every student should have gone a 5-day observership in any EHA hospital before they get sponsored. Is one of the criteria. So it is not enough that you want to aspire to be a doctor, you want to get into a medical college, you are studying very hard. But you must know what starts after you get your degree. So this is probably the taste or physician sample of the hospital. So that is one of the criteria. So this is one of the parents actually giving the message on the day. And the picture downstairs is the whole team. Believers Hospital, we gave the devotion on the last day we left. And as I told you, when we came back, the whole doctors team, they accompanied us. We had 2-3 people helping us with our luggage because I think we had more when we came back after shopping and getting the tamarins also. So this is the driving force of the CEO and the director who helped us. Now, what is their aim? What is their vision? So this is taken from CMC Ludhiana. My work is for a king. Now in Champa, Reverend Penner and his wife, Martha, had started our hospital for leprosy patients because he felt that there was a lot of need in the 90s. 1900, he came from US to Champa and he created this hospital, which today has become a replicable model like the Karigari Hospital. I don't know whether you've seen or been to Karigari Hospital. This is a tertiary hospital for leprosy patients. Now, visiting this hospital in Champa was a very, very moving experience. The challenge that you see there, there's no aid. There is a doctor who's from CMC Ludhiana. After she's done her bond, she's gone elsewhere and practice. And the atmosphere there brought her back to work as a doctor there. So she is there addressing us in the first slide. And there was a beautiful, almost 2 hours of teaching session given by the physiotherapist there. If you see her, she gave such a beautiful, I went through my whole clinical first year experience, seeing all the types of leprosy and what are the reconstructive surgeries that's been done. So it was such a beautiful impression that I got. And I was just thinking the students who have gone to Champa can sail through their patients in medicine who get diabetic sensory neuropathies. It's exactly the same. The approach, the reconstructions, everything is being done there. So they have a code of conduct which is written there, very important. So the work is for a king. So these are some of the slides that she showed us. As I told you, everything from the point of diagnosis, treatment, as well as reconstructive surgery is being done in this hospital. It's worth visiting there and staying there for a week to know what social deprivation is. Even today, these leprosy patients don't come back to the mainstream. So this is our picture. The next thing was my department. Children are always impatient. Their name is, in whatever age they are, you have to do it immediately. There's no waiting for a child. I don't see any adults anywhere in this world. I see grown-up children remaining as children. My name is today. We always want everything done now. What I want it now. So we are guilty of many errors, but our worst crime is abandoning the children, because to him we cannot answer tomorrow. His name is today. So pediatrics is very important, but this is the state of the pediatric population there. Now, I just want to... There is a park in Champa. It's called the Crocodile Park. And you see crocodiles of this size, all resting in the afternoon. But in this park, full of palm trees, as we were spending about 1 hour here, I found this boy. I don't know whether you can see the little thing that he's having in his hand. What is he doing there in the afternoon? He's not in school. Can you see him? He has taken the young palm tree and he's made a little flower decorative and selling it for 25 rupees. What is he doing at this age in a park selling? Where is his education? Who is responsible for him? Is it a crocodile? There are so many grants, so many schemes. Why has it not reached him? Again, as I told you, the child has his rights. The right to education, the right to food, right to water, the right to a safe environment, the right to health care, a right to play. Can he have a good shelter? Now this is a slum area where the Champa Hospital social workers go. We went to a small place. We tried to, this lady is giving a health education. We tried to find out how their water is being used. It's highly filled with calcium. They don't boil it. They don't have any information about rainwater harvesting. So where do we start? This is my question. So last one, partnership. I know all of you all know that we have a mission and vision. So among our mission, we have partnership. Believers Church has got partnership and advocacy. So what is partnership? Partnership is, we all evolve from birth to death. We pass through stages called independence, interdependence, and then again dependence in our later life. So partnership, is it new? No. Joint family partnership is always there in India. It's our culture. But now we choose to be independent rather than be independent or interdependent. So what happens in a partnership is, two parties agree to cooperate, advance their mutual interests. They can bridge their gap in both expertise and knowledge, more cash, decrease the cost, and of course, we get a lot of opportunities. Lots and lots of opportunities are there for us to partner in for mutual benefits, and we can actually have moral support with each other. So as I told you, this Manjula ma'am, she has partnered with the Jagdishpur Hospital. So as Dr. Rajesh was telling, Dr. Timothy, Dr. Augustine, they come once in a month to Champa Hospital. All the ultrasounds which are required are done for these patients by booking. This is Dr. Feby and Dr. Manuel. I don't know, some people might remember Dr. Manuel. He has been doing a junior residency in Believers in 2016. Feby has done her MD medicine in Vellore, and after that she's come back for a 2-year bond. So both of them are working in Champa. You can see Manjula madam, and this is one day when all of them came, and I found a lovely little speech therapist there, Amy. She's all smiles and speech. Okay, she is a very nice person. She's also doing her 2-year bond after doing her course in speech therapy in CMC Vellore. So Manjula ma'am is actually trying to get everybody through CMC Vellore, CMC Ludhiana as partners. So there is a common interest to serve the poor, work for a king. So we are also trying to help them now. So when I went there, I did not have anything to do. The students were on the same lines as what happened in Jagdishpur. They were tagging all the clinicians who were coming there. We had only very few patients. There was not many patients because they don't want to give any money. If you give them free, then they will come. But if you charge them, they don't come. So this is Dr. Beulah. She is also doing her bond after, she is in charge of the critical care unit. This is Dr. Augustine and Timothy with them on the day they came. So all I could do was I sat and went through, as I told you, there was no neonatologist there. There were only midwives. Most of the time they were the ones doing. And we had one doctor who's done family medicine who's doing the cesareans there. She's also doing her bond from family, from CMC Vellore. So everything is partnership. I tried to do a NRP course to benefit our students as well as the nurses there. That's all I could do. It's just a beginning. So this is the hospital theatre that they have. Compare it to us. Nothing does more to unlock our individual potential than working with devoted partners. So when you have a devoted person to work with you, there's a lot of difference. We make a great partnership. We have trust. First thing is trust. Without trust, there cannot be any productive conflict. We need conflicts. You cannot say yes to everything. There will be conflicts. But we need what is called productive conflicts. Only then we become synergistic. We can when we have common values, we can have a two-way communication. It is not unidirectional flow of traffic of words. No hierarchy. We understand each other, we understand each other's challenges. Since we have common values, we have defined expectations, we treat each other with mutual respect and we keep our morale. So things are very rewarding when you have a great partnership with these values. Finally, my question is, I'm going to ask you a question. So what is the question is, what about partnership between the EHA hospital and Believers Church Medical College Hospital? Can we get our students to partner with the patients there? Because our institution, though, tells us God comforts us not to become comfortable, but to comfort others. This is Dr. Manjula has given me a small memento which I gave to our administration here. Sir is the center of our hub and spoke model. All of us are spokes. So how can we connect with this little hospital, which as I told you is showcased at the moment in a critical care level. Thank you. You want to answer my question or you want to ask new questions?
Not really. We'll just open the floor to discussion. So thank you very much, ma'am, for that thought-provoking presentation. I know there are a number of students here who have seen, especially from the 2020 batch, and I'm sure you would also be looking forward to your secondary hospital program. As they say, the cup is half full or half empty is often a picture we see. There are challenges here, but actually if you look at the positives which are there in these hospitals, there's so much to learn, so much for us to discover. In fact, in Vellore, I remember once they said it was a faculty orientation program. So many of our faculty, when we train our students, it's good to know where our children, many of them will work. From your pioneer batch of 2016, about 6 of them are working in mission hospitals like this. And so they have learned how to manage with less resources. So any questions from any of you want to ask? And then I would ask Dr. Thomas Chacko to wrap up this session with a few words and comments. Any questions from any of you? Do any of you want to answer Dr. Elizabeth's question? Actually, it's a beautiful opportunity. When we go and see these places, only these abstract ideas become a reality. We have a lot of ideas, perhaps not so correct ideas of mission hospitals. All hospitals are very different. We sent our students to 13 different locations. Each place has its own strengths and weaknesses. But I think each of the students have come back with a lot of food for thought in their lives. I'm sure some of them will be inspired to go back. Yes, Dr. Thomas, would you like to say a few words?
Thank you, Dr. Philip. What is common about all these secondary hospital postings, as Philip has mentioned, it is a learning experience for the students as well as the faculty, and it opens up the vista of possibilities for collaboration. For the students, it is transformative. They go from the comfort of Kerala and being in a so-called city, Tiruvalla, and they are shocked by the conditions that they see in North India. The landscape itself is different. Although we say Chattisgarh is the rice bowl of India, when we go there, I have been there in Champa pre-COVID with the students. So we see the landscapes all dried up. If you would have caught the 42-degree temperature there, naturally it scorches everything. But the government has done something which has, for example, solar-powered pumps and things like that, which irrigates the land, and so it. So the thing is totally, the students are shocked, and that leads to the transformation. Jack Meziro's transformative learning posits that it makes the student to reflect and rethink, why are we here and what can be done. And when they go and see the primary care being delivered by people, what Rajesh has mentioned, each person doing multitasking. So they could be specialist in one particular domain, but because the situation, they are in primary care setting, the needs are different and they have to climb down, and also they have to give expertise, the prior experience when they were juniors, and then rekindle their talents and apply them, because there is nobody else to provide them with the service. So most of these hospitals are not only, we call them secondary care hospitals, but mostly primary care with rudimentary of secondary care services that is possible. So the day starting with the devotion and then actual practice of love and care through the service to people who come to the hospital. Most of those people who come to the hospital, they have unmet needs. And these hospitals cater to the unmet needs. And then they see compassion in action. Instead of giving any kind of lectures, to see is to believe. And so these postings for the students is a transformative experience, and it helps them reflect deeper with the questions like, why am I here? What is my purpose in life? And they see role models who actually do, and so they are transformed, they are changed. Any amount of bookish knowledge will not help. So seeing is believing, and I'm sure many of them are touched and they commit. And as Philip has mentioned, the pioneer batch, some of them have actually seen the benefit and the need for the people to be cared for, and they have opted to go and serve, at least for a couple of years, I think, so that they can do their little bit to serve the needy. So with compassion, love, and other insights, they come back richer, and they are much more holistic, wholesome doctors who will be appreciated by the patients. And I think that is the common thing. And Champa is a beautiful place. We can do shopping, as Elizabeth has mentioned. A lot of silk saris. The Kora silk is the one that is popular in Madhya Pradesh. It is being produced and it employs a lot of female workers. So it gives, she has mentioned women's empowerment. So when the women who are housewives, when they start earning, their value increases. Their participation in decision making happens. And that is women's empowerment. So thank you for the opportunity.
So thank you very much for all of you for coming and for taking part, and I hope some of the students and some of us also are all inspired to pray for these people who are working in these difficult situations, and also perhaps in the coming SHP postings probably go and visit. So thank you from the principal's office. Thank you Girija ma'am also for being part of this, encouraging this initiative, and it's really the support of the entire team here which is making this possible. Thank you very much. Have a good day.